Chapter 1, Introduction to Sterile Processing. The Central Service Department, also known as the Sterile Processing Department, SPD, serves as the vital hub and service center of every healthcare facility. Its primary mission is to provide safe, functional, and sterile medical devices to support patient care. The term central implies that these services are consolidated in one single location to ensure uniformity and efficiency. The word service highlights the department's essential role in assisting other clinical units. We often describe this department as the heart of the medical center. This is a highly accurate physiological analogy. Just as the human heart receives deoxygenated blood, cleanses it through the lungs, and pumps oxygenated blood back to the body to sustain life, the Sterile Processing Department receives soiled and contaminated instruments, cleanses and sterilizes them, and then distributes them back to critical care areas. If this cycle fails, the hospital cannot function and surgical procedures cannot proceed safely. While the Sterile Processing Department serves many areas, such as the emergency department, labor and delivery, and cardiac catheterization labs, the operating room, remains the department's largest and most important customer. The relationship between the technician and the surgical staff is the most critical workflow link in the entire hospital. Historically, instrument processing was often decentralized. This meant that cleaning and sterilization were performed in various utility rooms across the hospital by nurses or aides who had many other duties. In that environment, there was no standardization and a high risk of error. Modern healthcare standards now mandate the centralization of instrument processing. Centralization is critical for several reasons. First, it allows for the efficient use of complex and expensive equipment. Second, it allows a facility to concentrate specialized, highly trained teams in one location. Third, it ensures that every instrument is processed exactly the same way every single time. This shift toward centralization was driven largely by advancing technologies. In the early days of surgery, instruments were simple stainless steel tools. However, the rise of minimally invasive surgery, known as MIS, changed the field forever. As surgical instruments became more complex, sophisticated, and delicate, the need for a dedicated space and specialized knowledge became absolute. Modern technologies, such as robotic surgical systems and complex fiber optic endoscopes, require precise cleaning and sterilization protocols that cannot be performed in a general utility room. These advancing technologies also include electronic tracking systems that allow the department to monitor the location and processing history of every instrument in real time. This ensures that the operating room receives a set that is safe, complete, and ready for immediate use in surgery. By integrating these technical systems with a professional workflow, the department creates a standardized environment that protects both the patient and the healthcare worker. This standardized environment is physically realized through the sterile processing workflow, which is governed by a strict one-way flow. This concept is the mandatory foundation of infection control. To ensure patient safety, the department is designed as a linear path where items move progressively from soiled areas to clean areas and finally to sterile areas. The primary goal of this flow is to prevent cross-contamination, meaning that clean or sterile items must never come into contact with soiled instruments or contaminated environments. This segregation is maintained through physical barriers, such as permanent walls and separate corridors, that keep the decontamination area isolated from the clean assembly area. Beyond physical walls, the department utilizes advanced facility infrastructure to manage airflow. The decontamination area is maintained under negative air pressure, which means the air pressure inside the room is lower than the surrounding corridors. This creates a vacuum effect that keeps airborne contaminants contained within the soiled space. Conversely, clean areas, such as the preparation and packaging room, are maintained under positive air pressure. Higher pressure in these areas pushes clean air out whenever a door is opened, which prevents dust and microorganisms from entering the environment where instruments are being assembled. The first and most critical step in the processing cycle is decontamination. This is the physical and chemical process of rendering an item safe for handling by personnel who are not wearing specialized personal protective equipment, PPE. It is also the necessary prerequisite for further processing. Technicians in this area receive soiled instruments directly from clinical units and must wear specialized personal protective equipment to protect themselves from biohazards. They use manual cleaning methods and mechanical washers to remove bioburden, which consists of blood, tissue, and other organic matter. The workbook emphasizes that if an item is not properly cleaned, it cannot be sterilized, because any remaining soil can act as a shield for bacteria. Once items are safe to handle, they move through the workflow into the preparation and packaging area, which is often called the assembly area. In this clean environment, technicians perform a meticulous inspection of every instrument. Using lighted magnifying glasses, they check for cleanliness, alignment, and functionality to ensure the surgeon has a tool that works perfectly. Instruments are then assembled into specific trays or sets based on a count sheet, which acts as a recipe to ensure no item is missing. These trays are then wrapped in sterilization materials or placed in rigid containers to maintain their sterile state until the point of use. Following assembly, the items move into the sterilization phase. Sterilization is the process by which all forms of microbial life, including highly resistant bacterial spores, are completely destroyed. While there are several methods available, the most common is high-temperature steam. For devices that are sensitive to heat and moisture, technicians utilize low-temperature methods such as ethylene oxide, EO, or hydrogen peroxide gas plasma. Once the process is complete, the final stage is sterile storage and distribution. Sterile items are kept in a climate-controlled environment to prevent moisture buildup or package degradation. From this area, technicians pick case carts for scheduled surgeries and deliver life-saving supplies back to the operating room, which completes the core clinical workflow of the department. The foundation of all these technical tasks is the processing cycle, which is a continuous loop of 9 distinct steps. This cycle begins with receiving, where soiled items arrive at the decontamination area from various clinical units. These items are then sorted based on their specific cleaning requirements, followed by the actual cleaning stage, where all visible bioburden is removed. After cleaning, every instrument undergoes a meticulous inspection to check for any remaining soil or physical damage. Once verified, the instruments are assembled into sets and then packaged using specialized wraps or rigid containers to maintain sterility. The next step is sterilization, which utilizes high heat or low temperature chemicals to destroy all forms of microbial life, including spores. Following a proper cooling period, the items are moved into sterile storage, and finally, they are distributed back to the clinical units for use. Every step in this cycle is dependent on the one before it, and a failure in any single stage will compromise the safety of the entire process. To master this complex cycle, a technician must develop a strong foundation of basic job knowledge and specialized skills. This begins with a thorough understanding of facility systems which support the processing environment. Technicians must understand how high-quality water systems are used to prevent instrument staining and how specialized air filtration protects the clean environment from dust and microorganisms. They must also recognize the importance of lighting and plumbing systems that allow for the safe and ergonomic handling of heavy instrument trays. By understanding these underlying systems, technicians can identify when an environmental failure might put patient safety at risk. Communication skills are equally vital for the success of a sterile processing professional. Technicians must be able to coordinate closely with surgical teams to ensure that the correct instruments are available for every procedure. This requires the use of professional medical terminology to avoid confusion and the ability to listen carefully to the specific needs of the operating room staff. Effective communication also extends to the internal team within the department, where clear handoffs and documentation prevent errors during the processing cycle. Strong verbal and written communication ensures that the department functions as a cohesive unit during both routine and emergency situations. Employability skills further define the professional identity of the sterile processing technician. These skills include core attributes such as punctuality, reliability, and a strong work ethic that ensures tasks are completed thoroughly. Technicians must also demonstrate critical thinking and attention to detail, which are necessary for identifying subtle defects in complex surgical tools. Maintaining a professional appearance and a positive attitude contributes to a collaborative environment where every team member is focused on the common goal of patient safety. By developing these soft skills, technicians prove their competency and readiness for the high-stakes environment of the medical center. The professional role of the technician is also defined by a set of significant legal responsibilities. We must strictly adhere to federal mandates such as the Health Insurance Portability and Accountability Act, HIPAA, which protects patient confidentiality. Technicians also follow the requirements of the Safe Medical Devices Act, which regulates the reporting of device-related injuries or malfunctions. Understanding these legal frameworks ensures that the facility remains in compliance with national standards and that the rights of the patient are always protected. These laws provide the formal boundaries within which every sterile processing task must be performed. At the very core of this profession is the concept of ethics and the surgical conscience. Surgical conscience is the inner ethical drive that compels a technician to do the right thing for the patient even when no one else is watching. It is the unwavering willingness to admit a mistake, such as dropping a sterile item or noticing a failed chemical indicator, and taking immediate action to fix the error. There is no room for compromise or shortcuts in this field because a single mistake can lead to a devastating surgical site infection. A strong surgical conscience ensures that the technician always prioritizes the well-being of the patient above their own convenience. Safety practices and resource management are the final pillars that support the work of the department. Safety practices include the consistent use of personal protective equipment and the following of safety data sheets, SDS, to prevent exposure to hazardous chemicals. Technicians also engage in resource management through lean efficiency, which focuses on minimizing waste and optimizing the turnover of expensive instrument sets. By managing time and materials effectively, the department can provide high-quality service while reducing costs for the healthcare facility. These combined responsibilities ensure that every technician acts as a guardian of patient safety by providing instruments that are safe, functional, and sterile. This concludes our study of Chapter 1.